Welcome back, dear viewer. This is KAK in the morning. As I mentioned earlier, today our topic of discussion is suicide prevention. Remember, the world marked Suicide Awareness Week. That is from 4th of September through 10th of September, which according to the World Health Organization, 10th September was a Suicide Prevention Day, just basically creating awareness of what suicide is, and most importantly, just looking at the prevention. So that's exactly what you are going to focus on this morning. Remember, you can always be part of this discussion by sending in an SMS, comment, or question via our number, that is 01112244, or you can just comment on our social media on Facebook and YouTube. We are live as KAK TV Kenya. Twitter is KAK TV _ Kenya, and the hashtag to use is KAK in the morning, as well as suicide prevention awareness. So on set, I'm being joined by Rahab Karuri, who is the coordinator of counseling services at Kenya Institute of Business and Counseling Studies. In short, that is KIBCO. Rahab, karibu sana.
Thank you so much, Ida. I'm happy to be here.
Thank you so much. And let's start. Probably there's someone who is wondering, as you were just mentioning, of now mental health and suicide. How do they connect, and how different are they from each other?
Thank you, Ida. Generally, suicide is seen to be a sign leading to a deeper issue, which is the mental health. And so when we talk about suicide, there are other things that might factor into someone wanting to take their lives, because suicide basically is an intent to either want to harm yourself, and which you hope to lead to death or severe pain. But most of the time we have found that those who intend to take their lives are suffering from a mental illness. So we can discuss suicide, but largely it is because of a mental health, and we're looking at depression, we're talking about bipolar, schizophrenia. Generally, mood disorders are what would cause one person to want to take their life, amongst other factors. Yes.
All right. So there has to be like a background of a mental health issue for you to probably want to commit suicide. And is it taken? Is suicide taken as a mental health issue? Because just looking at probably the laws of Kenya, when one commits suicide and you're fined committing suicide, you're taken to jail. Is it interlinked to a health issue, would you say?
Yes, it is. And actually, I'm very happy to maybe relay this information that the government of Kenya, the previous government of Kenya under the mental health, they instituted a task force on the mental health, and one of the things that this task force recommended was decriminalization of suicide, because what happens is there's a lot of stigma around suicide, and we're not able to help people who have either want to commit suicide or have attempted, you know. So even when it's there, you find like it's been covered up. Yes. So one of the things that we would hope this government would want to do is to implement that recommendation, because now when we decriminalize suicide, we'll be able to help people. And you also find that in Kenya, we don't have a lot of information as such, and even low-income countries, not just Kenya, low-income and middle-income countries, we're not able to address the issue of suicide because of the stigma around it, the fear, and then the criminalization. So you find that, yes, this person took their lives, but it's most likely to be recorded as homicide, you know, or murder, or unclear circumstances. The weapon or how they did it is likely not to be factored in. And so we need for that space to be open, and we need for suicide to be actually seen as a mental illness. The same way we were able as a society to come to a place where we recognize alcoholism as an illness. You know, there's a time we thought that alcoholics you want to. So the same way we were able to recognize alcoholism as an illness, and the government and the stakeholders came behind it, is the same thing we need to do with suicide and suicidality. We need to realize it as an illness, that this person is emotionally overwhelmed. They feel they're not able to deal with whatever is happening. And so how can we help them as a stakeholder, as the community, and by and large as the global community. Yeah, so we need to do that.
Definitely, and I'll agree with you that let's wait and see what the current government will do, not just on matters suicide, but generally just about mental health. And you've mentioned of very key factors, that is let me just talk of stigma and discrimination, as well as a country, we still do not have numbers well, because as you put it, we are not being told clearly that probably this person committed suicide, so the numbers are not as clear, but I'm sure probably just with the World Health Organization, as well as the Mental Health Committee and the policy, what would you say are the numbers? I know that Kenya was ranked 4th, I think, in Africa as far as mental health is concerned. So how do the numbers look like over that is suicide?
Yes, and Ida, that is very concerning. Having been ranked that high up, and people don't even imagine that mental health is something to be talked about. And globally, the WHO estimates that around 700,000 suicide deaths happen annually. And so we are talking about in every 40 seconds, one person is losing their lives to suicide. That is in low income and middle income countries, and Kenya is actually there. And now suicide is the 4th leading cause of death in people between the ages of 15 and 29. And when you look at Kenya, that is our biggest age bracket. That is actually what we pride ourselves about, that we have a lot of young people, but it is the 4th leading cause of death amongst those people. And the WHO estimated that for every day in Kenya, there are 4 people losing their lives to suicide. Yeah, so when we think about the day-to-day that has just begun, we can imagine that 4 people will take their lives today. Some will attempt and it will go through. Others, it will be a failed attempt, but it will still be suicide at the end of the day. And so when we look at those figures, we really need to talk to ourselves as a community, as a fabric. How can we look into this? And the National Task Force on Mental Health as well, one of the recommendations that they made is that mental health should be declared a national health emergency, a national health emergency. An emergency is something that needs immediacy and immediate action to it. And so that's my appeal as well to all the stakeholders, that we make mental health a national emergency, that we put in the resources that are needed. Is it the education that needs to be there? How do we do the reporting? How can we get this out there so that we don't lose lives? Because 4 lives every day, we are talking about 15 to 29. Those are the people who are pushing our economy. So we are saying that if we allow these people to die every day, we are in effect pushing back on the productivity of our nation.
Right. And just talking of let me say the issues to do with taking action, before we just look at probably what are some of the things or the risk factors that will lead into someone just even thinking of committing suicide. I mean, 4 people a day is not a joke. Is not a joke. You mentioned of let me say the means to which someone uses to commit suicide, and you've talked of let me say, now that we are in media, probably the media taking the action and just reporting of the numbers. Would you say it's good probably to talk of how someone committing suicide? Will it be a trigger to someone else, probably for them to commit suicide as well?
That's a very good question. Because that's a fear that people have, and that's where we talk about the stigma. You fear that if we talk about suicide, it will be opening up. But we call it raising awareness. It's letting people know that this is happening, it can be what you are feeling, but there is help. And so when we talk about media reporting, we're talking about how do you package it. You know, we're not saying that you package it in an alarmist kind of way, but it's like you want to pass information that young people are taking their lives because they're feeling emotionally overwhelmed or because they have various mental illnesses, but there is help. And that's where we talk about the other stakeholders coming in. So we have like the hotlines that you can call free. There are counselors, like now, for example, in KIPCO, we have an array of counselors. And so now the media reporting, really, we're talking about the packaging of it, because the main ways that people take their lives is either hanging themselves, there's use of pesticides, and then now in more advanced countries, there are those who they use a gun to shoot themselves. And these are things that are within the community. But once you raise that awareness, you begin a conversation. And I've come to understand and to even see that every time there is need for change, you begin it with a conversation. Yes, so we're beginning a conversation on mental health awareness with a focus on suicide. And then now that conversation trickles down to the families. And now people feel, I can talk about it. And now when you talk about it, you're able to be helped. And now we lessen one person, yes, or even all, if we're able to,
Great, and definitely that's what we hope for the future, even as we continue creating awareness. Now let's look at the risk factors. What would you say are some of the main causes that will lead now someone to not only just trying to commit suicide, but even the thought of them wanting to commit suicide?
Thank you, Ida. Like I mentioned earlier, suicide is not in a vacuum. It does not happen in a vacuum. Very rarely will someone just wake up and feel like they want to take their lives. And most of the time is that someone feels overwhelmed, that they're not able to deal with the current situation, and there are factors that lead to one person feeling more overwhelmed as opposed to the other person. And one of those factors is a family history of violence or suicide, because what that does is we talk about genetics, and there are things that are passed on emotionally within the family. You can look at a family and you see that this family, they have a tendency of taking their lives, you know, not in every generation, but you can almost trace back this one, and then after, you know. So they are the same way genetics, like you look like somebody else, there's a way that trauma can be passed down through the genetics of people or in a family. And so now that history begins now to make you susceptible. Okay, so the same way you can be susceptible to alcohol addiction if there was that alcoholism in the family, is the same way if there's a history of violence in the family, you are emotionally susceptible, you are weak, you know, okay, I'm sorry to use that word, but you're not able to really put up with a lot of emotional pressure. And so you find a young person, remember we're talking about the age of 15 and 29, you find that this young person is not able to put up with the demands that come up with it at the workplace. Is it relational demands? So they're not able to face up with that. And then child abuse and trauma plays a big part in suicide attempts, because what happens, we call it post-traumatic stress disorder. This is trauma. You went through a traumatic event and you were not debriefed through it. You are not taken through what happened, and so you develop that disorder. And so that makes you very hypersensitive, and the way your workings of your brain are, in a way, it's altered. And so you're very sensitive, and you are likely to be overwhelmed very easily because you have nightmares, you have panic attacks, you have anxiety. You know, you almost feel when PTSD patients talk, they talk about it like it's almost like an out-of-body experience. You are here, but you feel like you're not here, because the trauma has a way of rewiring your brain. And so if you don't go through therapy, that rewiring can push you to the edge where you feel you can't live here in the present day. And we see it a lot with our soldiers. They take their lives. Actually, psychology started as a way to help soldiers because of that PTSD. Yeah, because the rates of suicide and depression are very high because trauma rewires your brain. And then we talked about mood disorders, and these are basically depression where you have a lowness. You know, depression, to very in layman's language, is you feel like you're in a big hole, a big black hole. Is like you can't get out of it, and no matter what happens, you just can't cheer up. And then we have bipolar. Bipolar is a person who has both the highs and the lows. So one time they're very high, it can last for almost a week or so, or even more, and then after that they do a dive. We call it like a crash. Then they crash, and so the highs, those that oscillating can really make someone feel out of place, and they want to take their life. There's also schizophrenia, still a mental illness that pushes one person to feel a bit destabilized, and they want to take their lives. Then the other factor is when you know someone who went through suicide. So this is grief. Because the thing with grief, one of the stages of grief is depression. And when you're in that stage, you are similar to someone who is depressed in terms of the clinical depression. And so what happens is when you have known someone who has taken their life through suicide and you are not properly debriefed from it, there's a tendency to want to do it as well. And that is if this person was very close to you. So we are looking at any type of loss and grief. Did you lose a loved one? Is it loss of a relationship, loss of a job, you know, financial crisis? All those can lead someone to want to take their lives. And then we have physical illnesses, chronic illnesses that come with a lot of pain, can make someone want to take their lives. So we are looking at cancer, especially cancer, because of the radiotherapy, the chemotherapy. It's very harrowing, even for your family watching you going through it. So this person can in event go into a state of depression because they have lost something, and also they might want to take their lives. And any other chronic illness, HIV, that would cause this person great pain, great distress, and in a sense destabilize their current life. And then we are also looking at lack of access to mental health care. When someone does not have that, which is now goes back to my request that I made, I feel like the stakeholders should make this an open topic. When you feel like you can't access someone for help, you feel like your only ultimate choice is to take your life. Yes, it's actually suicide. But if we're able to make mental health accessible, you can get help, we can lower the charges for it, then people will feel like I can go out for this help. Yes, so that's a very high risk factor, especially in developing countries and in closed cultures, countries like China, you know, the eastern side of the world, where they have a closed culture. And so mental health help is not really accessible, and so we bring the stigma again and the fear. What if people know, you know, you are hidden from your family members, or you know, taken to Mathare hospital, you know? So such things would cause this person to want to just end it and take their lives. Yes. And so we're also looking at a lot of drug dependence, alcohol and drug dependence. Again, when you take substances, they alter your brain, because the way the human body works is a functioning of hormones. Like I mentioned, mental disorders, it's an imbalance of certain hormones within your body. And so like alcohol and all other types of drugs, there's a way they rewire your brain, and you are likely to have hallucinations. We call them, you can have tactile, you know, you feel something is working on you, you're seeing people are after you, you know, bizarreness, you're hearing voices, you're having nightmares. Some even present in physical symptoms, the sweating, you know, the hyperness, and all that factors in to rewire your brain. And that person can feel like it's too much. And then now when we talk about dependence, we mean this person cannot live without this alcohol, they cannot live without this substance. So we are also saying their life has been hindered in a way. So maybe they are not able to get married, they can't keep a job, they can't even be clean, you know, their life is dependent on that substance. And so when that person gets to what we call rock bottom, they can either seek for help, or ultimately decide to take their lives. Yeah. And so those are some of the factors. There are many others, but those are some of the factors that would cause a person to feel like they want to take their life. And then sexual abuse. I had forgotten to mention sexual abuse in whatever context. We're talking about GBV, gender-based violence within the family, sexual abuse. Is it in the workplace, on our streets? Some places are not very safe. We're also talking about homosexuality, because nowadays the young people have a gender crisis. And like I mentioned about communities that are not so open, you find like this young person is feeling a certain way, and they're very afraid, and they're feeling like, if I come out and say how I'm feeling, it will be shame, you know, I'll be judged, I will lose certain opportunities. And so instead of seeking help, they choose to take their lives. Yeah, and all that, maybe rape, sodomy is also something that happens among our young people. But now the shame that comes with it, you would rather end your life than seek help.
Right. Thank you so much for that. Remember, we are looking at a suicide prevention awareness, and the world marked a suicide prevention week. That is from 4th of September to 10th of September, and definitely the final day climaxing to a suicide prevention day, that is 10th of September. Remember, this is a week that has been set aside by the World Health Organization just to create awareness and definitely prevent the cases of suicide, not just in the country but worldwide as well. So you can still send in your comments and be part of this discussion through our SMS number, that is 0111 220044. We take a very short break. We'll be coming back with Rahab Karuri just to look at the science as well as the prevention, which is the main area that we'll definitely focus on. So we take a very short break. We'll be right back. We are looking at our suicide prevention awareness, even as the world just continues marking and creating awareness about mental health issues. So just to read a few of your comments, Gideon Kips, thank you so much for watching. Josie says, thanks for having this conversation. Most people struggle with this and are ashamed, but by you publicly talking about it, you become a voice to voiceless and create hope that they are not alone. Thank you so much, Josie, for that. And Rahab, to you now, you talked of, let me say, just some of the risk factors. And from your conversation, what I got is that someone cannot just wake up in a day and or just wake up and decide that today I want to take my own life. And in most cases, after someone has committed suicide or they've died of suicide, we'll hear probably over the community or the family and anyone that was around them just talking of how calm they were, how easy they were not showing any signs. Maybe we have those signs that someone will see, either physically, and we have those that will just decide to be calm and quiet. Let me just say probably a depression or something. What would you say are some of the signs or the telltale signs that someone will just have a look and know that things are not going so well with this particular individual?
Thank you, Ida. Like we have been discussing, suicide is a symptom in itself, and it's a symptom of an underlying issue. Like we've talked about, could be trauma, a mental illness, or a crisis that has happened, you know, a genetic factor. But by and large, suicide is always is a conversation in the mind of the patient. Allow me to use the word patient. For purposes of this discussion. It's always in the mind of the patient. It does not begin, the day this person takes their life is not the day that conversation began. It begins a long time, especially those who have depression. It could be a very ongoing conversation. And when we talk about suicidal ideation, there is active suicidal ideation and there is a passive suicidal ideation. So the passive suicidal ideation is whereby this person you just wish you were dead. you wish you would not wake up, you know, you have feelings of lethargy, you know, you just wish you would disappear, but you're not doing anything about it. So they could just be, you know, humping around like, okay, I wish I can just die, or I wish this life, you know, it's a passive statement they've made, but it's something that you should pick up on as a caregiver or like someone who is there. And then we have the active suicide ideation, where this person has a plan. This is how I will do it. And then they even have a means. Will I use a weapon, like I mentioned, a gun? Will you use a rope to hang yourself? Will you use pesticides? Because those are the three main. And then now we have like the ones who would want no pain. They use the G-core, you light it and then you just sleep overnight. So that's an active suicidal ideation. But the passivity can grow into the activeness. And what differentiates is one personality. We generally have people who we call phlegmatics, melancholics, like they overthink things, so they are likely to take time. They are likely to be hesitant, fearful. They're thinking, how will this affect my family? How will this, you know? So they take their time, you know, kind of like to put their things in order. And then we have like now the cholerics and the sanguines who are impulsive, you know, and so they can work on it very fast. But what we're saying is that the passivity can grow into them activeness of carrying out this suicidal threat. And I know largely in our culture, let's talk about Kenya, people are told akitaka kujiua watajiue. You know, I know you've heard that. Acha ajiue tuone venye atafanya. You know, by the way, exactly, yeah. Watu wa kujiua hawasemangi. If really you wanted to take your life, you know, you would have done it. Now, people are very different. Yeah, they're the quieter ones, the introverts who want to introspect. Now, those are the ones you mentioned, like, they're very quiet. They would likely not say what is going on inside them. And those are the most dangerous because they always catch people out of, you know, they're surprised, like you mentioned. People always say, Kai, we didn't see it coming. Na alikuwa tu sawa, you know. But then there are those, the extroverts, they talk a lot. And so people are likely to take them very lightly. You know, na by the ujue siku moja mtaamka mnikose. You know, you might take it, especially if it's a talkative child or a talkative person. The family is likely to assume they're looking for attention. Have you heard that? Yeah, you're seeking attention, you're acting out, or, you know. But by and large, what we are failing to realize and to hear as a society is the cry for help. So in the caring profession, we believe that every attempt to communicate suicide thoughts and suicidality is a cry for help. This person is generally just asking for help because no one would want to take their lives. And that's why sometimes it takes so long because either it's a harrowing thing, you know, like you actually want to kill yourself. And it does something to you. You know, the same way when people murder, they take lives, it does something to the person who takes that life. So now we're talking about you're taking it now on yourself. You know, you're deflecting it onto yourself. And so this person is at a scary position. They are really not okay. And so every communication for wanting to take your life, we say it is a cry for help. This person is seeking for your attention, not in a negative way, but in a positive way. So pay attention. Is it the passive talks or the active talks? And so let's look at some of the ways that this person, some of the signs that you can tell that a loved one is considering suicide, which is passive, or actually has a plan, which is the active aspect of it. And one of the things they will do is they will talk about wanting to die. So they will be fascinated with death and dying. You know, they really want to talk about death. We call it morbid themes. You know, they are so fascinated, especially with teenagers. Morbid things, they want darkness. You know, they want to watch dark things. They're always talking about death. When you pass a cemetery, they are all of a sudden excited, you know. So you notice like a dark theme that is coming upon this person. And they're talking about dying a lot. You know, some of them it's how does someone die? How do you feel, you know, when someone dies? So there's a lot of death talk, and they get so concerned when people talk about death. That is a sign that there is an active conversation in this person's mind about death and dying. And then they also talk about guilt. They feel guilty for being alive or ashamed. So they will express a lot of guilt in their conversation. You know, I'm sorry I did. Akina feel singefanya. You know, what if I didn't do? And it's an ongoing conversation. Again, I want to just put it out there that it is normal for you to wake up, Ida, and feel you don't want to wake up. That's normal. Because even when we talk about mental illness and we talk about depression, there's what we call the normal degree of sadness. That is fine because you're a human being. Sure. So there are days you will wake up and you feel, oh my God, I wish I can just not wake up today. But you don't have any ill intent to harm yourself or to take your life. That is normal. But when it's a constant, you know, conversation with you, I hate my life. I wish I would not wake up, you know, and there's a regret and a shame to you. I wish I was not born, or I'm such a burden to this family, you know. So now that is a concern that you have that conversation going on.
Now, let's now look at prevention, which definitely is the key matter that we should just try and bring forth. As you put it, we try as much as possible to reduce the number from 4 to 3 and even to 0 as much as we can. Now, with the signs that you've mentioned, how can we tell, and how can the society now come in just to probably just bring in help to these people, and even to those families that probably have lost a loved one as a result of suicide? How can they find help, or where can we now bring in help as far as this is concerned?
Thank you, Ida. And I think one thing I would like to point out is when you realize your loved one is giving things away or they're saying goodbye, you know, there's a tendency, like they're saying goodbye, that's a sign that they might want to take their lives. So it's very important to note that out. You know, they're giving things away. They're telling you what to do in case I'm not there. That's also a subtle way that this person could be wanting to take their lives. And like I had mentioned earlier on, the Ministry of Health, sorry, not Health, in the previous government, they actually came up with a national task force on mental health. And they identified 3 levels of how to bring about this intervention, so that now suicide can no longer be a stigma, it can no longer be what it is today, but it can be a better conversation. And the first level is interventions that are universal. And when we talk about this, we are looking at reaching whole populations. And this is aimed at reducing the risk factors that we had mentioned earlier on, and is going to bring about easy access, you know, to help. And so we are looking at reducing the access to means of suicide. So what can we do about it? You know, are there laws that should govern pesticide acquiring? You know, what can we do to govern? Is it ropes? Do people take their lives through ropes? What can we do? How can we reduce the accessibility to those means of harming yourself? We also need to improve on media reporting under the universal interventions. Again, the packaging. Let it be known out there that people are dying from suicide. Make it a conversation, but package it in a hopeful way that there is help. And so again, we go back to the stakeholders. You need to work with institutions that offer mental health. You need to work with the government and the key stakeholders. Is it at the county level? Do you want to take it down the constituency level, you know, until it gets to the general public? We're looking at improving community education about suicide prevention. As a family, like we have talked about, and which is what we are doing, how can you prevent your loved one from taking their lives? And it's all about awareness. Then the second tier is selective interventions, and this will target vulnerable subgroups of people who are not yet manifesting suicidality, but are likely to in the future. And those are the people we talked about. Either you know someone who died from suicide, or you're pending to be laid off from work, those who are about to be retired, you know, like the people in the army, you know, they could present with these symptoms. People who are going through chronic illnesses, they have not yet, but they are likely to. in the future. So we are looking at screening. How can we screen for this so that we find at what level they are, because there's always like a scale. Are they at the mild level? Is it moderate? Is it severe? And how can we intervene? So those who are not yet there, can we offer the right support so that they never get there? Those who are moderately there, we also put in the right support, therapy, you know, we come in with family support. And then those who are severely there, now we go now to the third tier, which is indicated interventions. And these ones are designed for vulnerable people who have been identified through the screening that was happened, that they actually have suicidal ideation, and some of them are active suicidal ideations. And so what we do is we use physical psychosocial treatments, that is talk therapy or psychotherapy if you wish, and then also pharmacological treatments, because like I mentioned, most of this is a mood disorder. And when we talk about mood disorders, you need some form of medication. So we're talking about antidepressants. If someone is manic, we're looking at a way to stabilize them, you know, mood stabilizers, so that we are able to help this person get to a place where their brain is reasoning properly. Yeah, because someone who is depressed, the frontal lobe of their brain, which is where you have reasoning capacity, thoughts, is normally hampered with. Yeah, so you'd want to remove that hormone so that that brain part can function properly. And so those are the three tiers that the Ministry of Health was able to identify. And I think it's a wonderful thing. Yeah.
It is. And just looking at from everything that you're talking about, I think then suicide should just be taken as a, can I say, a health condition? Yes. So that when probably when I'm going to seek for help, it's like I'm going to seek for help as a sick person who needs to definitely feel better. And I think that's where the universal health coverage comes in. I think with the recommendation, they should have actually included let me say mental health as a whole in the universal health coverage as well. Yeah, and so now let's just look at a solution now from the society's point of view. You've talked of stigma, we have discrimination. People can no longer come out and talk of how they're feeling or what exactly they are going through. You just talked of GBV as one of the risk factors. What do you think the society and the community can do just to help reduce these numbers?
Thank you, Ida. I think what we can do as stakeholders to help the society is to raise this awareness and to help them understand and realize that suicide is a symptom to an underlying problem. And it is not contagious. You know, it is not a bad omen. You know, so we need to demystify it. It's not a bad omen. It's not like when someone dies in this home, it will be like a ripple effect. It can be if it's not addressed. So we are talking about a lack of knowledge. These people need to understand that suicide is not a death sentence. It is not a penalty that this person killed themselves and then that's it. So we ostracize this family. No, we need to understand that there is help for this family and that help can be found. Yeah. So one of the things that the society can do is embrace people who have suicide attempts. Yes, because like I said, it's a cry for help. So we need for them to embrace these people as part of the family, because one of the things that leads people to take their lives is they lack social support. So you find like they might not have, not all of them, because especially those who have a mental illness, they might have the support, but really there is no cure for depression, unfortunately. Yeah. And sometimes you can do all you can and this person just takes their life. Yeah. So support, demystifying it, getting these people help, and then being a support, walking the journey with them will really help us. Yeah.
Okay. Now talking of demystifying, I'll just want now to try and link probably suicide to the spiritual, let me say, thoughts that people have. Probably when I talk of how I feel, when I talk of the signs that you've mentioned, we'll have, let me say, families that are so deep into religion. They'll be like, if you take your life, probably direct for shetani, or when you do blah blah blah. How would you try and just probably try and demystify the spiritual thoughts just behind now suicide?
Wow, that is a very good question, because that is one of the things keeping people from getting help, you know. And it's a valid concern that many people have, especially those who are spiritual and religious. But you know, the Bible also says, my people perish because of lack of knowledge. Sometimes what kills you is not knowing. And we say, what you don't know can't harm you, but in fact, what you don't know will harm you. And so you need to allow and embrace knowledge. And I think that's what education brought us. It brought us knowledge that understand that this person is sick and they need help. Even the Bible says that Jesus came to save the sick, you know, and the lost. So we are saying this person is sick and they need help. Allow us to help them, okay? What happens beyond, really, you know, there are very few people who died and then they came back to tell us what happens beyond. So we can only speculate that when you take your life, you go to hell. Because we don't know what happened. You know, we find someone dead and no one has gone and come back and told us, you know, this person, I found this person in hell because they took their life. That's speculation. And that's what we call the African culture myths. You know, there's a lot of speculation, a lot of shame, you know, so we are afraid for bad omens, no. And so what we want to say to our Christian community today, embrace knowledge, okay? You are not less of a Christian when you embrace knowledge, because you're acknowledging this thing is there. And you know, the Bible also says that every good gift comes from the Father. So doctors come from God, you know, as long as it's helping, it came from God. So also psychology came from God, because it is healing the soul of the person. It is healing the emotions of the person. And would you rather your person is alive to see the end of their days, or they die for fear of, you know, some form of stigma? Yeah, so let's embrace knowledge as a Christian community, because there's so much help. There is so much help out there. But if we allow ourselves to be stuck in speculations and fear, it will really cost our families a lot. Yeah, so let's embrace knowledge. Let us speak about it. If you know someone who went through in a family, let your child talk about it. Let them share their experience. That's also part of healing, you know, where they share their experience. I'm sure it will touch another person's life. Yeah.
All right. And now let us try and touch someone's life right now. We've talked of the signs, even as we wind up. You've talked of the signs, you've talked of the symptoms, and just generally about suicide prevention awareness. There could be someone at home who is having such signs. There could be, let me say, someone who has just read of the signs from their loved ones or just someone around them. What would you tell them, or just that person who is having suicidal thoughts? What will be your words to them, just looking at this camera?
Ida. So first, to the person who has suicidal ideations, I would want to assure you or reassure you that what you're feeling is normal. There are people wake up some days and you feel like you don't want to go through life. But if you let that feeling fester on, you are likely to be harboring a suicidal ideation. So one of the things I would ask you is to reach out for help. Someone you trust, a loved one. If you don't have a social support, please reach out to a counselor. If you don't know of a counselor, you can come to Kenya Institute of Business and Counseling Studies. We are located in Nairobi, but I'll also be sharing our contacts later so that a counselor can walk you through that journey. Because the thing with suicidality and everything that comes with it is that you're likely not to be able to do it on your own. You need help. So if you don't have an immediate person you can reach out to, I'll be sharing our contacts later, and please feel free to reach out to us. We can have it online, a virtual, if at all you feel you're not able to come to Nairobi or Kiambu or Thika. If you're able to, we can have someone meet you at one of our campuses. To someone who has a loved one that you're suspecting might be having suicidal ideations, the first thing you can do is do not be afraid, okay? Don't be afraid. Don't walk around them in eggshells, but address it. Bring up that conversation. Actually, studies have shown when you bring up that conversation, the likelihood of this person killing themselves is lower. So engage them in a conversation. You talk about taking your life. What are you thinking, or what do you mean about it? Have you thought of how to do it? How would you want to do it? How do you imagine you will feel? What do you hope to gain, or what do you imagine will happen after you take your life? So you engage them in this conversation, and what you're doing is that you're helping them to hear themselves. And as they hear themselves, they're realizing the repercussions that will come from this decision. Then the other thing, advise them to seek for help from a trusted counselor and a therapist. Some of them might need medications, they might need to see a psychiatrist, and then also reassure them of your support. Family support has shown to be one of the greatest ways that a person who has gone through suicide has overcome it. So be there as a support, walk through the journey, keep on checking up on them. Hey, have you woken up to go to work today? How are you feeling today? Have you eaten today? Have you taken your medication? Are you keeping up with your therapist appointment? Can I take you, can we go for a trip, until you're able to ascertain that this person now is at a better position. But when someone has attempted suicide, that continual support, even after they're through with their treatment, will really help them to avoid a relapse. Yeah.
Thank you so much. And I think I'm also so enlightened. There is a sign. There is one of the signs that you mentioned of probably someone when they pass through or just around a cemetery, and them seeing maybe the grave, they get excited, or just staying in the darkness. I think that is one thing. I could have known of everything that you mentioned, but that is a sign that I wasn't aware of. And thank you so much, Rahab, for sharing. Let me just read a few of your comments right here. A very informative topic that is well presented. Keep up the good work, Rahab and CAC TV. That is Julius from Kiambu. We also have Margaret saying today's topic on suicide prevention and awareness is an eye-opener to parents and guardians, especially now that children are at home. What a timely discussion to have. Thank you so much, Rahab. Probably I'll just give you an opportunity to share your contacts, as you put it. I think it's a very good way to help and just prevent suicide. So just go ahead and share, as well as probably where they can find you just to seek help. Yeah.
Thank you so much. Also, I think I should have mentioned that if someone has, if they believe in a higher power, like God, it helps for that person to be directed that way. Yeah, because maybe this person, they need a sense of living, they need a meaning. Yes. So if this person is religious or spiritual in any way, looking to a higher power has been known to help this person. Yes. So sometimes we need God to help us. Yes, sometimes. Yes. But there's also what you can do to help yourself. Yes. So we are located in 3 areas. That is Kiambu. Kiambu, we are just off the Kiambu road. It's a stage called Rowe. So on your way to Kirigiti, just before you get to the SEK church, you will find our campus there. And then in the Thika branch, we are located next to Chania Boys High School. So when just on your way to Chania Boys, you will see us before you get to Chania Boys. And then for the Nairobi campus, we are located in the southern building. This is opposite the Best Western Meridian Hotel. That's off Moi Avenue. But in case you're not able to get there, you can reach us on our phone line number. That is 0723 891 555. 0723 891 555. You can also get us on email. That is kipko13@gmail.com. And any of these avenues will be able to help you. And we're also on Facebook. That is still Kenya Institute of Business and Counseling Studies. Facebook and Twitter and also Instagram. Yeah, so looking forward to helping more lives.
All
Yes.
right. Thank you so much.
Thank you,
Rahab. Thank you for sharing, and thank you for just helping us in creating awareness before definitely September comes to an end. We had to help just create awareness, as you put it. The media is one of the tools that probably can be used just to reduce these numbers, as you put it. So thank you so much. All right, that was Rahab Karuri from or a coordinator of counseling services at Kenya Institute of Business and Counseling Studies, that is KIBCO. And I'll just use one of the phrases that many use as they create awareness about mental health. It is said that it is okay not to be okay. So that is something that you should embrace, and as Rahab put it, try as much as possible to just go and seek help if you're having any of the signs that she mentioned. If you're members of the community, probably the government, family members, and any loved one, if you're just reading these signs that have been mentioned by Rahab, try as much as possible to help this member of the society, for us to try as much as possible to bring the suicide numbers down. So this year's theme, even as the world marks Mental Health Month as well as Suicide Prevention Month, is creating hope through action. And that's exactly what we've done here with the help of Rahab Karuri. So she's also shared over their numbers as well as social media platforms. That's exactly where you can go and seek help. So thank you so much for tuning in.